In today's Health Alert, a key advisor to the FDA says it's time to rethink who needs to get a booster shot and that maybe young, healthy Americans don't need another one. So our chief health editor, Dr. Partha Nandi, joining us on this advisory and the current guidelines and what this could mean, Doc.
Yeah, we were talking about this, right? Yeah. Dr. Offit is a member of the FDA Vaccine and Related Biological Products Advisory Committee, and he wrote a perspective piece that was just published in the New England Journal of Medicine, a prestigious journal. First, I want to point out that he's not anti-vaccine. Dr. Offit said he's fully vaccinated and boosted as well, but he's questioning this, whether or not healthy young people need another booster dose. He points to data that analyzed serum from people boosted with the bivalent shot and compared it to people boosted with the original booster. Now, the bivalent shot, remember, targets not only the original coronavirus strain, but also Omicron's BA4 and BA5 subvariants. And these tests show that levels of neutralizing antibodies against BA4 and 5 were comparable to the original booster. This suggests that the new bivalent shot isn't much more effective than the original booster, according to that data. Now, Dr. Offit feels it's not practical, in his opinion, to ask young, healthy people to get boosted with a variant-specific vaccine and then get boosted again months later with a different variant-specific formula when they're less likely to suffer severe disease or less likely to die from COVID-19, and that the updated boosters, in his opinion, are best for older adults, those who are immunocompromised or have multiple coexisting conditions.
Now, this is a tough one, Doc, because somebody might hear this and say, I knew it. You know, I mean, do you agree with Dr. Offit and what this could mean in terms of time and getting another booster?
Again, we were talking about this, right? So I support the CDC's recommendations, but it's not unrealistic to say that these could potentially change. The FDA Vaccine Committee is meeting later this month to discuss what the next version of COVID shots could be for the general public. And there's more real-world data than when we had before when bivalent shots were first approved. What I don't agree with is giving up on trying to prevent symptomatic infections in healthy young people. Telling them that they don't need to get vaccinated might lead them to believe, as you just said, that they will not get severe disease or long COVID, because it absolutely can. I had patients who were young and had that, and they may not take this virus as seriously as they should. This could then mean more spread, which could lead more older folks getting infected, and they're the ones most at risk for severe disease and death. But I really have good news for our seniors. A new Israeli study found this, that hospitalizations amongst people 65 and older who got the bivalent booster was reduced by a whopping 81%. That's great news. And this is compared to people who had gotten at least 2 vaccinations but not the new vaccine. That to me is amazing. The point of the vaccines to me is not just to prevent deaths, but to prevent severe illness and complications. So in my opinion, the boosters are needed for everyone who's eligible.
Well, and that's a tricky part about COVID, because as you were saying, you could not have it, but you could spread it. You could go to your older relative's house and pass it on.
And it's not just about me, it's about the community. You may do okay and get sick for a couple of days, but you go to your grandma's house, your parents' house, and then you spread it to them. That's the problem.
Oh, all right, Doc. We'll be watching it. I know you will be.
All right.
Thank you.
Of course, my pleasure.
And don't forget to watch an all-new episode of the Dr. Nandi Show this Sunday at 4 p.m. here on 7. In this week's episode, Dr. Nandi sits down with Dr. Rick Hansen and Dr. Gail Parker to talk about the healing power of the mind.